Hi everyone, this is Grace with Make Bullhead Better, and today I'm interviewing a new business in town. They've only been here about a month, and I think they have a really cool business plan, which is going to benefit Bullhead City. So let's get into this interview.
This new business is located on Highway 95, 2135 Highway 95. Their phone number is 928-218-3493, and their hours of operation are Monday through Thursday, 7 a.m. to 4 p.m., Friday, 7 a.m. to noon, and closed on Saturday and Sunday. Both Sandra and Jorge are Mohave High School graduates.
My name is Jorge Mendoza. This is Ivy Health Primary Care. We just opened up. Our provider, Sandra Reyes Mendoza, my wife, she's been taking care of all our patients. Reception, definitely wanted to keep this as homey as possible. Definitely didn't want to have that doctor's office feel, that cold feel that most people get. I just have never liked that. We try to keep this as comfortable for our patients as possible. In the back here. So here we do have 3 patient rooms. We do also offer IV hydration as well. This here is room 1. We do women's checks, so this is our main GY room as well. Room 2. We did everything. We do our own lab draws here as well, which is really nice and very convenient for the patient. Anything to make it convenient for our patient. That's definitely number one.
My name is Sandra Reyes Mendoza with Ivy Health Primary Care. I am a nurse practitioner. Have been here, since I was a teenager. Started in the hotel industry and kind of veered off to medical. I was working at the hospital in the business office and saw that MCC was doing a nursing program, and it kind of triggered that, and that's where that started. From then on, I was a nurse working at the hospital, and I saw a need, right? Being a nurse and working with the hospital, we were the go-tos between the patients and the doctors. So I saw a need for education. I saw a need for the Latino community, and I decided to advance my education and my career, hence the nurse practitioner. So once I became a nurse practitioner and I've been working at various offices, I found another need, and that's kind of where we're at today. So what I have noticed is the way insurances are going and, the way healthcare is going is people aren't numbers, and that's kind of where we're at, right? You go into your doctor's office, you're waiting a long time, and when you are, you're limited to 5 to 15 minutes. And we lack that, right? There's no more of that personalization and, the doctor doesn't know me or practitioner doesn't know me. And I wanted to get away from that, and I wanted to focus back to where it should be, in my opinion. And that's knowing my patients, having them be able to be comfortable with me, and having time to discuss any concerns that they have. And that way, when they leave, they feel more comfortable or satisfied or more educated on their disease processes, which I think makes a better outcome, right? So the more we know about our health, the more that we trust our provider, the better we are at following the recommendations. Here, we have decided not to go with insurances, which allows me to be able to focus on my patients. So we do a monthly membership here where you pay a monthly membership and you have unlimited visits, right? That's good. Right now, if people have insurances, they have to pay a copay, deductible, coinsurance every time they see their provider. And then they have a long wait. So, you only have 15 minutes to address certain issues. And if you've been waiting 3 months to see your provider, that list gets kind of long. So we don't have to worry about that with the model that we chose with not having insurances. I do still work with insurances, so if you need to see a specialist or anything out of my scope of practice, I'm going to still refer you to where you need to be. And I'll work with insurances like that. For folks that also still have insurance, you still can use your labs, you can still get diagnostics through your insurance, and you can still get your medications through your insurance. And for those folks that don't have any insurance, and that's where I found the big need here, there's a lot of people that either make too much to afford insurance or not enough to qualify for free insurance. So this kind of meets that happy medium. It's reasonably priced, and you get all your preventative care. We have been working with Riverside Pharmacy, who has been working with our patients with no insurance on getting them affordable, necessary medications. So big props to Riverside Pharmacy.
So we start with ages 8 and up, all the way into geriatric, but we do start at 8 to 17 is $25 a month. 18 to 39 is going to be $55 a month. And then 40 to 64 will be $75, and anything above 65 and above will be at $95 a month. We do as well for family members, so if you do have multiple signings, yeah, you will get discounted as well. And then since we do offer the IV hydration, you'll also get a discounted rate on that as well.
What is included in that monthly program? So they can come as many times as they want, but when they come, what is it that they get?
So, well, essentially you're getting good customer service, right? Or service, which means you're able to address any health concerns that you have. If it's, you're having ear pain, nasal congestion, or you're having increased stressors, and mental health is just as important as our physical health.
Something that I could see coming up would be if you come in here to see you and you don't have insurance, but then you have something that's out of your scope of practice and you need to see somebody. Where do you refer these people that don't have insurance? Because seeing that specialist, I would say you'd run into that problem of...
Yes. So thankfully we have a lot of good providers in the area that do work with people that don't have insurance. So I usually work with different providers. I'll call them or see, hey, this is a concern I'm having. Is this something you would be able to see? They don't have insurance. What can we do? And I'm still working up that network because this is a little different for people. Unfortunately, right now we do have to outsource our diagnostics. So right now you get cheaper diagnostics in Vegas. But basically, being in this particular environment is I'm able to sit and to call, right? And that's that continuity that we don't have anymore. So I can call different providers and there's more of a conversation, and it's a multi-system approach versus, when I worked at the clinics with insurances, is you can't, because you have to keep seeing patients. So you rely on just the insurances authorizing, or hey, this insurance only allows you to see this provider. And in this area, we're very limited.
Yeah. When you're paying so much for insurance and you really can't use it, it's really too bad. But yeah, just being able to call, text, we can do video calls, we can do all that stuff. We're not limited. Telehealth, yeah.
With no restrictions.
Exactly.
Because with insurances, even your telehealth is restricted. So there is no restriction, and they're all HIPAA compliant platforms that we use. And what we like the most is even the text, because everybody's busy and everybody's into texting, and we can literally do a consult via text.
Exactly.
Oh, it's very convenient. And we even have forms that we can send, and it's literally answer yes, no, whatever, which helps with the diagnostics, right? Because that's typically what we do anyhow. So very convenient. So I think our patients have loved it so far.
Yeah. It's really like having somebody, like a friend, a member, a family member, anybody in the medical industry. And it's
a little hydration party. And
could you explain hydration for people that, obviously people know they need to drink water, but what is IV hydration for those that don't know?
So IV hydration is not just necessarily the fluid itself, because we are typically dehydrated in our today's society, right? We're on the go, and sometimes we forget to stay hydrated. So what it entails is vitamin-infused fluids. And it comes in a variety of different styles, so targeting different groups. So for example, we have immunity. The vitamins are targeted to boost that immune system. We have some for people that exercise and need that quick recovery of the muscles, release certain cytokines, and this kind of helps with that recovery process. Beauty, we have some that highlight collagen factors and help boost your body's natural ability to heal. So that's kind of what it entails, and it's pretty fun. We also have one for, if we go out and party a little bit too much or a little, hungover the next day, we have something for that as well. So it's kind of nice. So the biggest thing for me is I'm here because a lot of people didn't know where I was, and so we're here. We're at 2135 Highway 95. More personalized care.
Thanks for watching this interview with Make Bullhead Better. If you would like more information, you can contact them at this phone number and this website, and tell them that Grace from Make Bullhead Better referred you.